What is this infertility?
We're talking about two partners, male and female, who are having sexual intercourse and there's no conception, there's no baby from them.
Can a man be infertile?
100%. You know, modern days, technology researches have shown us that we have more men that are less manly. A couple desiring the fruit of the womb must have sex 2 to 3 times per week.
Doctor, why should a man be infertile?
Most of us are very active sexually coming up as young guys. All this Gen Z generation, what a man can do, a woman can do better. You take Colorado, you take Loud, you take Whiz, all sorts of things. Let me give you a scenario. This guy came and the penis was almost falling off. He has contracted disease. This guy had sex unprotected at a clubhouse. By the time he brought out his penile shaft, we realized so much damages have been done. So men, don't just push your wife to the clinic. Accompany her. Get examined like your wife.
Hello there. You are welcome to Omega Fertility Podcast with Dr. Abraham Fasasi. I'm your host on this program. My name is Dayo Fowe. This podcast is sponsored and powered by Omega Golden Fertility. And in this podcast, we are here to take you through what infertility is and what you can do to take hold of your fertility challenges. Dr. Abraham Fasasi will be here to enlighten us more on the challenges faced by couples who are faced by these infertility challenges. Dr. Abraham Fasasi, you are welcome to this podcast.
Thank you so much, Mr. Diowa.
You are looking good.
Thank you.
And you are looking young.
But yeah, I'm not an old man though.
How long have you been in this fertility treatment?
Looking back on our journey in the fertility service industry of Nigeria, we are 22 years now and counting.
Wow, this is lovely. And you are not looking your age.
That's the grace of the Almighty.
That's lovely.
Yes.
What motivated you into this special area of infertility treatment?
Basically, I would call it a divine direction, because oftentimes we have our plans and God has his own plans as well. And going by the plans of God, you're always going to be on the right path. And it's always going to be the desired result.
And now, Omega Golden Fertility is going into the podcast. But what is the motivation that really spurred you into this podcast?
You know, when you've been around for some time, you cover several clinics, you meet different patients, talk about the experience. You know, unfortunately, everybody will not get pregnant at once in IVF, regardless of whoever is handling it. So when you hear people's story, you see some loopholes, a few things possibly misconceived, misconstrued, or particularly not well presented in a way that is understandable to the layman. So this is all about bringing the complex stories into simple terms that is comprehensible to every common man who is experiencing delayed conception.
And from what Dr. Abraham Fasasi has said, you will discover that in this podcast, we will take you through the basics before we go to the simplest and the complex areas of infertility management. Dr. Abraham Fasasi, what goes on in your mind when you see a couple faced with this challenge of infertility?
Oftentimes, being who we are, you know, when you meet people of your age, older than you, people younger than you, and having the pain, the stress of delayed conception written all over them, you could only imagine yourself in their shoes. And when you put yourself in their shoes, you begin to have waves of idea after listening to them as to how you come in and make the whole difference.
But I want to ask, how do couples present themselves with this infertility challenge?
Good enough for the society at this time.
Yeah.
The modern age of the media has changed the perception of the public in a lot of ways. How do I mean? Because consciously or subconsciously, you pick your phone, you hear somebody share their story on Facebook, on Instagram, on TikTok, you watch. From there, you pick yours. So by the time they come to the clinic, it's no longer a big deal. Because you see it like someone that has malaria who goes to the doctor, someone that has typhoid fever, and you know that the next is you go to the lab, you go to the doctor, you get tested. So when you see it that way, the burden is lessened.
Okay.
So at the end of the day,
in other words, now infertility as a challenge is more. It should be seen more as a disease, not something death sentence.
not really. Fertility, if you ask me, is just a regular illness, right? It is a regular illness, like malaria, like typhoid.
In other words, infertility can be cured.
Oh yes, 100%.
Good.
The cure, the management of infertility is over 4 decades now, globally. And there have been millions of children delivered from this technology.
Okay.
So it's just for our people to take advantage of this. While we look at the side of the world where we belong, we're looking at spiritual aspects and all that. But then, our clergy on every level should also be getting their consultants, the patients, towards the hospital.
That's why this podcast will take you through the basics. We take you through the complex situations in infertility challenges. And in this podcast, we want Dr. Abraham Fasasi to let us know what are the expectations we look forward to in this podcast.
Coming to this Omega Golden Fertility podcast, we're going to demystify the entire concept of fertility management called IVF. Okay. So the common man who sells the basic things in the market can understand and can discuss with the next person the experiences of the patients of the past who succeeded, those who failed, those who retried again and succeeded, those who were given one option before and were led to other options and succeeded. How have they gone through it? What were their experiences before they finally smile? We're going to be sharing that. At the same time, how does the couple, the two partners, as it were, the male and the female partner, gone through this whole experience? Because it can be very mentally touching. It can be torturing for couple going through fertility treatment. So how do they come into each other's aid? These are things we're going to be bringing down here. The modern advances in the industry, globally, we're going to be discussing it because not everybody will go through IVF.
Wow.
There are so many shoes available. One shoe will not fill all soul and sundry.
Doctor, before we even go further in any of these things, what is this infertility?
When you talk about infertility, we're talking about two partners, male and female, who have been living together or have been copulating, having sexual intercourse regularly, at least 2 to 3 times in a week. And they've done that for complete 1 year. And there's no conception, there's no baby from them. That is if the woman is pretty young, in her late 20s, early 30s. But when a woman passes the age of 35, she's looking at 37 or she's above that, and you are not just getting married. Because oftentimes we see ladies, our women now, they don't marry pretty early because of their career postures and financial stability. They are getting married at 37, 36. If you get married at that age and you're having sexual intercourse with your husband without protection in a space of 6 months, and there's no pregnancy, there's no baby looming around the corner, then you have to start looking at your options.
Doctor, you are talking about age. I can remember in those days when we were growing up, and they call it touch and go. What happens in those days that is not happening now?
Unfortunately, there are generational changes.
Okay.
There are evolutionary changes.
Okay.
Our lifestyles have changed. Those days, nobody was using phone. Nobody knows what Android was all about. Right? The number of vehicles on the road now are so much.
Okay.
Those contribute to their own part of infertility challenge that people go through. There are so many hazards people experience in course of livelihood.
Okay.
And this plays a role. And the truth about the matter is that generationally, we are becoming less of who we are, who we used to be. Our parents got married, they got children
Yes.
with ease.
Yes.
But in modern day, a young guy at 28 getting married to a young lady of 24.
Yes.
Now you see them in the clinic more often.
What can be the causes?
There are 1 million causes.
Yes, just
Every individual have their one reason or the other why things have not worked on the bed in the house. And except we run investigations on them, we might not be able to pinpoint why couple A is different from couple B.
okay.
That's how it goes there.
When a couple present themselves in a clinic, what are the first things that we look for?
Basically, when they come to us, we want to listen to them,
Yes.
their journey, because oftentimes before the couple come to the fertility clinic, they've been to the family physician, they've seen their gynecologist, they've touched 1 or 2 hospitals referred by family and friends. When things don't come the way they desire, there's a particular need, there's a pressure now to see a specialist in fertility. And I saw they are coming to the IVF clinic. So when they get to us, we want to listen to their stories. We want to listen to the things they've been through, the interventions that have been undergone at other clinics, at other hospitals. Having gone through all that, listen to them, we knew quite well an idea of what the challenge might be. Then the next thing, we're going to be running investigation on this couple.
Okay.
A series of panel of investigations that will pinpoint at the end of the day conclusively, this is why things have not happened the way they desire. By the time we're able to pinpoint these challenges, we discuss with them in a way they can understand. And because we already knew for sure what the challenges are, then that tells us which treatment options will benefit this couple so good.
So you can see from what Dr. Fasasi is telling us, we will go through these infertility topics one after the other. We will even take you through what the process of called ART, assisted reproductive techniques, the processes of IVF itself, and he mentioned some things about lifestyle changes. We will still talk about those ones so that every one of us will be well equipped and we take that destiny in our hands. And doctor mentioned something which I chuckled at that time. He said that if a couple, they have been having sexual activity 2 to 3 times in a week, doctor, is that not too stressful?
When you look at it, the ideal for a couple that nearly got married or they have been married for some time, it's unfortunate this part of the world we find ourselves because there's so much pressure, economic pressure on the man. There's economic pressure on the woman. The two of them are running left and right to ensure they make ends meet. But in reality, a couple desiring the fruit of the womb must have sex 2 to 3 times per week. And where there's no economic pressure, where there's no psychological breakdown, the man looking at his beautiful wife or his beautiful partner, we geared, we have the energy, the arousal will be there to go do the magic, which make the woman to smile. Okay. So oftentimes with this economic pressure, you realize that the man is becoming less manly by ability to engage in 2 to 3 times sexual intercourse with the wife under 7 days. Okay. So most time we see couples, we see partners, they really don't have a major problem, but the timeliness of their sexual intercourse is a problem. So those people don't need IVF. It is counseling, a little guide here and there, and the next thing, the baby is around the corner.
Good.
That's it.
It's good. But sometimes I heard people say you are not manly because, doctor, you have even mentioned it, that when a man is not manly enough. In other words, can a man be infertile?
100%. Gone are those days where when we're young, the problem is usually the woman's. Everybody from the husband family is focusing on the wife.
They focus on the woman.
They want to nail the woman like they nailed Christ, right? But modern days, technology, researches have shown us that we have more men that are less manly.
Doctor,
I'm being honest, I'm a man. We have more men that are less manly than they used to be.
What?
If you bring 10 men today,
Yes.
I kid you not, you will not get 5 that can actually sleep with your wife 3 times in a week and do the magic.
but they have sexual intercourse.
They make sexual intercourse. That's the problem we have in the society. People say I do 5 runs. My wife knows I'm a strong man. Because you do 5 runs is not enough for you to impregnate your wife. What is it that you are discharging to your wife?
Okay.
What is the quality of what you are discharging? You
Okay.
can give her a bowl into your wife. What is the constituent of this one bowl that you are discharging?
Okay.
You are like this just one man that run around every woman he sees. But when they open up to you, you do 2 minutes, you drop down.
Okay.
You can no longer kickstart the engine and make it run. That's the problem we're having here now.
Okay.
So men are less manly. We need to accept it and let the man be open enough to walk to the doctor. Just like the way they push their wives
Okay.
to go and see the doctor. I'm okay, I'm okay. Go and see the doctor. Even somebody got pregnant for me last 2 years.
Okay.
No, men should present themselves to the doctor. Let them get examined. Because you are doing 3 runs, 4 runs between that and 5 a.m., it doesn't make you reproductive.
Okay.
It doesn't make you competent. It doesn't make sure they tell us that you are competent father, that you can impregnate
Then
a
what
woman.
is the prevalence of men being infertile?
I'll tell you of a fact.
Yes.
If we are going to be honest with ourselves,
Okay.
we don't have less than 6 over 10 that are infertile currently.
Doctor, 60%.
I'm telling you, if we see 10 patients in one clinic,
Yes.
you will not see less than 5 to 6 that the sperm is the problem, that the man is the reason why the woman has not gotten pregnant. Let's be honest with ourselves.
Wow.
Talking language of clarity and maximum understanding. If you get 100 men visit the IVF clinic, you will not get less than 55, 58, 60 of them that the reason the woman had not been pregnant is the man. The man goes to the regular laboratory. Oh, the sperm is there. You have good, the sperm is this. But the things the IVF units are looking out for, the things the specialists, andrologists are looking out for, they are not being sought after in the regular roadside laboratory. They are specialists on them.
Then, doctor, if you say 60% of the men can present themselves as infertile, what is the percentage of the women?
You see women oscillate between 40-45%
Okay.
as the reasons why conception is not happening in the house.
Okay.
And oftentimes you're going to see about 10-15% that both partners have issues.
Okay.
Why they are not getting pregnant. There's a lot to do on the woman, there's a lot to do on the man.
Okay.
And the two of them come together, reason together in front of the specialist. They take the necessary chart
Okay.
and protocol that restore fecundity of the man and then parenthood in the couple.
Okay.
But for a fact, I'm saying it loud on open media, we have more men becoming less of men from our findings in fertility clinic. So men, don't just push your wife to the clinic. Accompany her. Get examined like your wife from the very first day she goes to the clinic. Because oftentimes we have this challenge. The woman will go to one clinic or the other. The husband will keep claiming, I'm okay, I'm okay, I'm okay. See my result. I do 5 runs. No, it's not so. Let's be honest with ourselves.
But doctor, we have these stories and prevalence that when they go to fertility clinics,
Yeah.
they will say the wife is okay, the man is okay. Then what can be the challenge this couple are still facing?
There's what we call unexplained infertility.
Good.
Unexplained infertility, you check everything about the man. Regular investigations. The man is good.
Good.
According to WHO standard, the sperm fulfills the criteria.
Okay.
You check the woman, gynecologically, she's fantastic. Great obstetric history, gynecologic history, excellent. But what actually is the problem? It is the limits of what? Of investigation that are done. They are what we call the regular investigations. They are advanced investigation. You can look at the sperm under the microscope times 40 times 20 and you get your result. If we subject this sperm to times 400 times 6,600, these are high strength microscope, high magnification microscope. It's going to show us in further details what the sperm is made of. So when you say the man is okay and the wife is okay, I want to believe the woman is okay, because the woman investigation can be concluded in one go. But when it comes to the man, I'll tell you of a fact. How many hospitals in Nigeria knows the cellular content of the sperm? How many of us do this investigation? Except you go to this level, you'll not be able to unravel the man. The sperm that is 100 million, 80% motility. You do IVF with it, and the sperm, the egg did not fertilize. The embryo did not divide. And yet you said the man is okay. Something definitely is wrong. You need to step up in your investigation. When you step up, you begin to unravel the mystery surrounding this. You are okay as the man, you are okay as the wife.
Okay, doctor. This reminds me, I was in one of your presentation to doctors in Abeokuta. Okay. And this issue of unexplained infertility came up. And you are saying they are calling it unexplained, and you are calling it explained. Please, can you just clarify?
Like I said, there's a reason there are different specialties in medicine. There's a reason there are levels of professionalism.
Yeah.
The training, the exposure will make all the difference. Unfortunately, at the level of a general hospital, teaching hospital, federal medical center, health center, the highest microscope they have there is times 100.
Okay.
And the one they use to analyze sperm is times 20, times 40. How do you compare the power of 20, the power of 40 to power of 400? The gap is so wide. How do you compare that to power of 6,600? When you talk about IVF unit comprises of different departments of specialists who are only focused on sperm from the man and the eggs from the woman. So when you focus on the man, you are called an andrologist. An andrologist here has levels. There's molecular andrology.
Okay.
You want to dig deep to know more about the sperm.
Doctor,
and as such, you can rate a man based on the sperm.
Doctor, don't let us go there, because in this podcast, what doctor has just mentioned, we will still go there into detail.
It's a whole lot of detail.
With this package, this podcast, it's a lot of things that you can benefit from. But before we go to other things, doctor, why should a man be infertile? Because you have said about the sperm. What can make the sperm not to fertilize? Please.
Before you talk about the sperm not fertilizing an egg or impregnating a woman, you also have to look at the history of the man. Most of us are very active sexually coming up as young guys. A lot of us are erratic. All this Gen Z generation, what a man can do, a woman can do better. You take Colorado, you take Cloud.
Doctor.
You take Whiz. All sorts of things. So you contract infection. Let me give you a scenario. I had a guy some time ago, some 8 years ago. Very handsome young man, living large. I mean, imagine some 2018, you are driving a CLK 350. As a 22, 23-year-old guy. This guy came and the penis was almost falling off. He has contracted disease. That was, I think that was syphilis, if I'm not mistaken. He came and he was weak, dejected, and looking down. Was it malaria? Was it typhoid? By the time he removed his boxer shorts, you see chancre all over his penis. Wounds, open wounds, like the size of my fingertip. About 5 places on his penis. This guy had sex unprotected at a clubhouse. He had some strange feelings. He visited the pharmacy store. Unfortunately, he got some medication. He didn't cure. Maybe some roadside nurses. He visited them, all these auxiliary visiting house to treat people. He didn't get better. So after about 2 months on this journey, I think about 2 months or 2 months plus, he came to the clinic. By the time he brought out his spinal shaft, we realized so much damages have been done. Imagine a lot of people go to Tradomedical Center. The symptoms is subsided, but the damages is still continue within. So by the time the damage continues, such a guy in another 5-8 years, he wants to settle down properly. An innocent woman become a victim. So he's having sex, he's releasing sperm, but it's just releasing water. There's nothing there. The infection of yesteryears had been disseminated in the system, and it has killed his germinal disc.
Okay.
And invariably, the testicular cells are already destroyed. So sperm is not being manufactured. There's a major problem there. That's a topic for another day. And sometimes you have people come, they have sperm, but the sperm is low. A man with low sperm count, there's no way the most beautiful woman, the most fertile woman will not get pregnant. Okay. That requires intervention of specialists and subspecialists.
Okay.
And such infection of the past can be passed to the woman, innocent woman, and the woman to develop infection. And you see pelvic inflammatory disease left and right.
People, you can see the passion with which doctor is dishing out all these things, because he has the first-hand information about all this. What we are talking about in this podcast, we'll still talk about female infertility. He has just taken us through few things about male infertility, and we'll discuss about IVF. And before I go, doctor, what is this IVF that we are even talking about?
IVF, it's an acronym for in vitro fertilization. What do we call in vitro? Outside the body.
What does that mean?
So, fertilization, the coming together of a man and a woman.
Yes.
Other than the conventional style of sexual intercourse on the bed in the house, getting the sperm of the man, getting the seed of the woman, which is the eggs, outside their body to the laboratory. The specialists work on it, called the embryologist, and invariably they ensure there is development, a satisfactory development, and such products are returned into the woman, into the womb of the woman that has been prepared. That is a short introduction to IVF.
Doctor, we still have to explain to us, because he's an expert in this area. He has just, in just one sentence, he has just broken down what is IVF. But I know there are variants of this IVF. Doctor, what are the variants of this IVF?
The IVF is generally talking about every approach,
yes,
every intervention that you can take on a couple, yes, on two partners, without them having to lay on each other in the bedroom.
Okay.
So that comes from the angle of time sexual intercourse, okay, artificial insemination,
okay,
IVF in itself. Is it IVF donor egg, okay, or own egg? Is it donor sperm or own sperm?
Okay.
Is it surrogacy we are talking about? Somebody carrying the pregnancy for another couple.
Okay.
Do you understand now? Because we just gloss on the men just now.
Yes.
We have women who are very fertile, but they get pregnant, but they are always losing their pregnancies. They don't carry to 9 months. How do we ensure such people get fulfilled as a desirous mother, and they have their own baby from their own loins, but somebody else help them to carry? This is just a simple analogy of you having everything, but you don't have to cook. Your kitchen experience is poor. You just get a chef to cook for you. You provide the money, you provide all the ingredients, all the condiments, but somebody put it all together, then the soup is yours, the food is yours. You pay the person goes away.
Okay.
Those are also IVF.
It has been an exciting time speaking with Dr. Abraham Fasasi. This is the end of the program, the maiden edition of this podcast. Dr. Abraham Fasasi, what are your parting shots?
All I can say is that for as many that have questions, concerns about their fertility journey, this is a one-shot plug. In any event, you will not miss out one thing that might bother you. Will we break it down to the best of understanding, and you understand it just the way you understand A, B, and C. See you next episode.
In the parting shot with Dr. Abraham Fasasi, he has told us that we will break them down for you. And this is an assurance that you can get from this podcast. He will break them down for you. And this is the end of this maiden edition of this podcast. Don't forget to follow us on all our social media and subscribe to our YouTube channel, Omega Golden Fertility. I remain your host, Dayo Fowe. Thank you.